In the interest of community service, Power 88 presents live talk shows to inform, enlighten, and to stimulate thought and dialogue. The views expressed on this program are not necessarily those of the staff and management of KCEP or the EOB. Now sit back, relax, and enjoy the program, or call in and participate at 647-3688. Funding for community partners for better health on KCEP Power 88 is underwritten by the Southern Nevada Health District. And here is your host.
Good morning, Las Vegas, and welcome to A Healthier Tomorrow. I'm Will Rucker, and I am so glad that you have tuned in to this morning's program. I want you to let everyone you know that A Healthier Tomorrow is on the air right now. We've got two fantastic guests who are going to share some health information that we really need to hear about. We're going to hear about the chronic disease diabetes, which is such an important topic for our community. We're also going to learn a little bit about MS, and it's our first time having that topic on the show. So really excited to welcome these guests and to have you joining us for this conversation. As always, the A Healthier Tomorrow program is sponsored by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. March is National Nutrition Month. During this month, everyone is invited to learn about making informed food choices and developing healthful eating and physical activity habits. To help save money and reduce food waste, plan your meals and snacks and make a grocery list before heading to the store. For more tips, visit www.gethealthyclarkcounty.org. All right. With that in mind, I'd like to welcome our first guest from the Health District. She's no stranger to this audience and to this show. None other than our very special friend, Rayleen Earney. Good morning.
Well, good morning, everyone. How are you?
Good. So glad to have you back on the program. And we're talking about diabetes and prediabetes today. So just kind of want to dive right in. First, tell us a little bit about your background, and then we'll talk about the programs that you have.
Oh, sure. I'm just so happy to be here. I've noticed that diabetes has certainly been on the radar for a long time, and a disease that kind of ran into my great-grandmother, had it. So I bring out personal experience in with that. And my mom also had pre-diabetes. My mom had a baby weighing 10 pounds or more at birth, my brother. And so just to share that I do have that personal issue there. So I've been at the Health District for 25 years and teaching classes and hoping people stay on the side. If they have pre-diabetes, they manage it so they don't develop type 2, but at the same time, they can manage type 2 diabetes so they don't get those complications we hear about.
Wow, so lots and lots of experience, both personal and professional. So I think that means we've got the right person on today to talk about this subject.
Well, thank you.
Awesome. So let's dive in. How many people have diabetes nationally?
Well, nationally, there's a lot. It's just growing. So basically, it's about 37.3 million people, and that number is just so hard to think about. It's just so big, and it keeps growing. Even in Nevada, certainly it's more than doubled the percentage since I've been here teaching classes. So it's pretty much 11%. So it's kind of a big number.
That is a big number. So that's about 267,000 Nevadans?
Yes. So that's the estimated. So you can say that's more than a city, in some cities. But yes, so that's a lot of folks. And the thing is that's so disturbing is the number just keeps going up and up and up. So we need to really raise awareness about this disease and also just give people the resources they desperately need.
Yeah. So I'm just kind of doing a little bit more math here. So 11%, and I am not a math expert. That's not my field, but I can count. That's about 1 out of 10, right?
Yes. So that would hold up nationally. About 1 in 10 folks have it, and most people don't know it. So, or they get diagnosed in the emergency room instead of learning earlier on with their primary care doctor.
Yeah, and I know that, we talk about diabetes a lot, but I think that there's still some misconceptions out there. A lot of people call it sugar or, those proverbial things. What is diabetes, and what's the difference between diabetes and prediabetes?
Yeah, so diabetes, when a person's sugar level is super high, then of course they're diagnosed. Their doctors give them a blood test and they have diabetes, but prediabetes is a condition where blood sugar is higher than normal, but not yet high enough to be diagnosed as having diabetes. So I look at it this way. You get your A1C blood test, and it's an average, the last 2 to 3 months worth of your blood test all averaged together. And if you've got a blood test of 5.7% or higher, then most likely you probably have pre-diabetes. And that condition can be reversed, but it's higher than normal blood sugar.
Okay. And with this, does it go away, or is it something that people just have to manage?
Yeah, it can go away, meaning that prediabetes is something that can be reversed. So we like to point that out to people. Just because you have a diagnosis of prediabetes, which used to be seen as a touch of sugar or borderline diabetes, but it's a condition, a very serious one. And that means that if you do nothing about your prediabetes and you just kind of go on through life and not managing, not eating better and getting more physical activity, you could develop type 2 diabetes within 5 years. So it's something that's not going to go away on its own. You do your work, and then you let the medicine do the rest.
Awesome. So what does the Southern Nevada Health District provide to help people manage or delay diabetes?
We have wonderful classes at the Southern Nevada Health District and diabetes self-management. We call it conversation maps because we like to have a conversation with people. So it's not intimidating. You come in, you share your experiences with diabetes. If you're a caregiver, a friend, a family member, or the person with pre-diabetes or diabetes, we'll take both. Those are the best classes. They're combined. And it's very interactive. So we tell you, we give you portion plates, we give you fitness trackers and things like that. We help you set a goal. So it's really nice to come and have that conversation and just see that you're not alone. You have other folks that can help, manage. And it's like a nice support network.
Awesome. And I just want to give a plug for the classes that are scheduled monthly. You can register by calling 702-759-1270 or email gethealthy@snhd.org. And so they'll give you all the information you need that way. But what are some of the benefits of these classes?
Yeah, so the benefits are learning how to live healthier. So does that mean? Meaning get more movement in your day. Maybe someone has a desk job like me and they just need to get up and stretch or move around every 30 minutes. Also, those healthy lifestyle things are really, really helpful. Also, reducing the risk of diabetes-related complications. We hear about blindness, kidney disease, heart disease, and stroke as really scary things that can happen to someone. But when you manage it, your condition, then you don't have to develop those things. So make sure you get those checkups if you don't have a doctor. Certainly, the health district has primary care, and we have a list of others as well.
Awesome. Well, we have a wide range of folks who listen to our show, and so I want to know who's actually at risk for developing prediabetes and type 2 diabetes.
In fact, it's everyone really is at risk, but certain minorities and folks with different backgrounds, Asians, Pacific Islanders, African Americans, folks who are overweight or obese. There's several like that, but it's cultural. Also, we can't do anything about our age, so folks who are older, certainly have a higher risk for prediabetes and diabetes, age 60 and up. But now they're starting to say that the guidelines are testing people for prediabetes at age 35 and up with symptoms. So it's really serious to take that into heart.
Wow. And what are some of the signs or symptoms of diabetes?
Going to the bathroom a lot, so frequent urination, being hungry a lot, not, curbing your appetite, thirsty, dry mouth, those kinds of things. I know we live in the desert and we should be drinking lots of water, but water does help us keep a healthy, steady blood sugar.
So drink more water, get more active, eat healthier food. Is that what I'm hearing?
That is right. And we even give them a portion plate, and they laugh at me. It looks like a kid's plate, but 9-inch plate instead of these dinner platters. That way you're eating less food. Half your plate vegetables, a quarter of your plate lean proteins, and a quarter of your plate the starchy foods.
Well, is it true? Is it true, Rayleen, that in other countries that portion size is actually what we should be eating, not what we have here in the United States?
That is correct. So here we come to restaurants here in the U.S. and folks want to give you value for your meals, and so they want to give you the large portion sizes, and it's a cultural thing here. But in other countries that is true. You look at some of the European countries and they have small portions. They spread things out during their day. They get more activity, walking and bicycling and things like that. So it's really something we need to do here, and even in Asian Pacific Islander countries, they used to fish, for themselves, but they think, we have it great over here because, it's America, so eat more in this kind of cultural thing. So
right.
You're absolutely right.
Very interesting. So did you say after 35, we're starting to look at prediabetes?
Yes, it used to be 45 and up with symptoms, and now it's 35. So the American Diabetes Association issued that guideline within the past 2 years. So it's something that we need to do. And if we have families, get tested. Just ask your primary care about getting a blood test.
Wow, Will, we have to stay on that. You're getting up there.
I'm only 25. I don't know what you're talking about.
I'm 25. You can't be 25 too.
Oh, you're both young. Look at me. My goodness, my gray hair. I know you can't see on the radio.
I love it, but I will just echo that sentiment about culture, because when you do travel, you learn different things, even as far as having ice in the beverage. Mm-hmm. So they drink more room temperature, which is, of course, better for digestion. So there are a lot of things that we could improve and learn from others on. And I think that even psychologically, just seeing a full plate, that's all that we care about. It doesn't matter if it's the 12-inch or, the platter size. If it's a full plate, we feel good about that.
Right. Absolutely. Just box up half your dinner, bring it home, and, those kinds of things. And also the beverages, the sodas. It's better to drink sparkling water or flavor your own water. And we have all those recipes at gethealthyclarkcounty.org.
I love it. I love it.
Great plug.
And so there's another topic that I'm seeing here on my sheet, and it's tobacco. Talk to us a little bit about that. How does that impact diabetes?
Oh, well, certainly when you do use tobacco products, then that narrows the arteries and those types of things. Your heart has to pump extra hard. So that's why a lot of these things are, they go together, heart disease and diabetes. So tobacco, if you haven't started yet, don't. And if you started, you got 1-800-QUIT now to make sure you sign up, because once you start, you quit, then your body starts repairing itself. And a lot of folks don't realize that. Just even, a week after quitting, your body starts, repairing. And if they're coughing, that's a good sign that the lungs are starting to heal. So, basically, I'm going off the cuff here, but, our system, our workers, they teach, these things. They teach other healthcare plans about, brief tobacco intervention training and other things like that. So it's really worth going to our website for that, the tobacco resources as well.
Perfect. Well, thank you so much for all of this fantastic information. I know I even learned something, and we've talked about this probably 10 times, so you always bring something that's of value. Before we let you go, anything else that you want to share with the audience for that we didn't get to cover?
Oh, just that our classes are free, and, we do get grant money for that. So I just want to let you know that we do give some nice prizes to people in our classes, as long as we have them. So it's really worth your while. Classes are 2 hours, they're in 2 parts, 1 week, and then the following week you come back, you get a nice certificate and a lot of fun giveaways. So thanks for having me on.
Absolutely. So glad that you were here. Thank you. The Healthier Tomorrow radio program is sponsored by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. Learning how to manage your diabetes may seem overwhelming unless you know where to go for help. If you or someone you care about is living with diabetes, our free classes are designed to help you live healthier. Sign up today at www.gethealthyclarkcounty.org.
Well, Will, we want to talk about something today that is not very popular, and that is washing of the hands. Didn't we?
I sent you that emoji with the face because I knew you were going to actually pull this out.
Because it's a very real thing. As we are in flu season, right? Flu, pneumonia, RSV, COVID is still around. Washing of the hands is so important. I go into ladies' restrooms and people come out and just walk right out of the door. It's very fascinating to me, and I just stare at them like, huh? What just happened? Because I know when I was a child, my mother taught me to wash my hands before I started to eat something, all of these different things. So just culturally to me, I'm just like, is this maybe not a African American thing? Is this not an American thing? Like, I'm one of those people, I always think culturally, right? Like, maybe this is not something that everyone is taught. What do you think about it, Will?
I just think folks need some reminders because we all have so much on our mind. We're so disconnected from being present nowadays that I think we just honestly forget. I will share there are just 5 easy steps to proper hand washing.
Please tell us.
And before I tell you the steps, I will tell you what is not the proper way.
Okay.
The proper way is not putting soap on your hand and then washing the soap off.
Very true. Very true.
So here's how we actually do it. Wet your hands first, ideally with warm water. Apply the soap. Lather your hands, rub them together, get the front and back sides. Scrub for about 20 seconds, sing happy birthday to yourself or something like that. And then just rinse your hands under the water.
Right.
That's it. So wet, lather, rinse.
And this was so important during the pandemic that even the World Health Organization had videos on how to properly wash your hands. So for them at a higher level and bigger level to say, hey, we noticed that people aren't washing their hands correctly. And because it's a pandemic, we all need to learn this special skill set.
I love that you called it a special skill set.
It's very special. Because I just want people to wash their hands.
I do too, but you know what? There's no shame in not knowing, right?
There's no shame in not knowing. But if you know, what did Maya Angelou say?
When you know better, you do better.
Amen. All right. So as we transition, I wanted to say something really quick before we get to our new guest. I wanted to say happy birthday to Will Rucker.
Thank you. Oh, my goodness. With presents and everything.
Yes.
I love it.
We're not going to sing the birthday song today. Okay. My voice is a little hoarse.
You're a little hoarse?
Yes. Okay. But happy birthday. Well, we have to celebrate the little things, the big things in life these days. That's what the pandemic taught me. So we have to celebrate people and let them know that we are happy that they are here in this earth.
Wow. Well, thank you.
You are welcome. And now we're going to bring on our other guest, Keiara Katz. Welcome, Keiara.
Thank you. Thank you so much for having me. I'm so excited.
You look nervous over there. Don't be nervous.
I am a little bit, but as we start talking, it'll go away.
Yes, it will. Keiara and I met at the Girls Who Brunch tour this past summer, right? Mm-hmm. Nicola Mitchell does a Girls Who Brunch tour. She takes basically a tour around the city or around the country, helping disadvantaged African American Black girls know their worth and empower them. And she does this whole brunch thing because, we all like to brunch. And that's where Keiara and I met. And we started talking about her diagnosis, which is multiple sclerosis. Can you tell us what that is and just tell us how you found out that you had it?
Absolutely. So full disclosure, I am not a healthcare professional. All views mentioned are my own by way of my personal experience. None of my views are endorsed by any organization, so I just want to state that.
Thank you for that.
I don't want anyone calling me out like, oh, she said this and it's really that.
We appreciate that.
Absolutely. So MS is said to be a unpredictable, often disabling disease of the central nervous system, and that's pretty much our brain and our spinal cord. So what happens with MS, it creates a disruption in the flow of information between the brain and the body. See, I have to catch myself to make sure I said that. And there are a basic of 4 courses with MS. So when I say courses, I mean like different stages, right? So the first one is clinically isolated syndrome. The second one is relapsing-remitting MS, which is most common. And that is the form I was diagnosed with. After that, we have secondary, primary, progressive MS, and then after that is the last stage, which is primary progressive MS. And secondary and primary progressive MS, I would say, is a little more aggressive with the body. So again, I was diagnosed, which is now they just refer to it as RMS. I was diagnosed in 2017. It is interesting that we were talking about diabetes before I started speaking about MS, because when I noticed symptoms, the first thing that primary physician told me was, it sounds like diabetes, right? And oftentimes that happens to us culturally as Black people. We get thrown into these boxes, right? because we look away. Like, it can't be this, so it has to be that. So, but that physician, I was new to him, so he said, I'll just test you for everything. So, this is such... I try to still digest this because I recently learned within the past 2 years I was misdiagnosed 10 years ago.
Wow.
And I recently learned that because I have more knowledge, more intel. So in 2014, at that time I was 26, I had a episode. I was driving and I had a hand tremor. And I remember I pulled my car over because I didn't know what was happening. You know, I never experienced a tremor. And instantly I called my mom. We always think our parents are doctors, especially our moms. So I called my mom and she told me to call my doctor. And at that time I had a different physician. So I called him and I addressed what was going on. He scheduled me to have an MRI, which is used to detect MS. And when the results came back, he diagnosed me with neuropathy. Again, I'm 26, so I guess the seriousness, I've always been healthy, always been athletic, but hearing neuropathy at 26, not having that basic knowledge of it, I just kept going on with my life, right? So 2 years after that, I had this intense episode where there's a tingling numbness sensation from, I want to say, my lower back to the bottom of my feet. And it felt like I slept wrong, maybe. I thought I was hungover. I went out the night before, but it just felt different. I believe we know our bodies, right? So this was a little more intense, and that was alarming to me, to really reach out to my primary care doctor at that time. And that's when he said, that sounds like diabetes, but I'll test you for everything. My results came back and he said, I'm 99.9% sure you have MS. When I heard it, of course, loosely I've heard of it, but MS, there's so many nuances, right? So people are not familiar with it. So that's one of the reasons why I advocate now. But when I heard it again, it felt like a ton of bricks, and I just went blank for a second. And, you know, there's certain disparities I've experienced with my journey, because even though he's telling me that, he also informs me that he can't diagnose me because he's not specialized to do that. So he would have to refer me out to a general neurologist. However, his MA says we can't refer her out because after today, we no longer accept her insurance.
Wow.
So I had that dropped on me. I had to find a different primary care doctor, and that took some time. And my memory is not that sharp, but, you know, this was so traumatic that I can remember this like it happened yesterday. And I remember I felt a new primary care doctor. She did the MRIs, my brain, my neck, and my spine. The results come back, and she said, I'm so sorry because you are so healthy. You're so young. It does look like MS. She immediately tells me that she's going to refer me to the best neurologist my insurance could cover. And I had loose knowledge at that time of MS, so I asked to be referred out to the Cleveland Clinic because they have MS specialists. She kept telling me my insurance does not cover that. That was misinformation. So throughout my journey, it's been a lot of conflicted misinformation. So I would like to clear that up today on some of the resources that are available. And then also to go back to what relapsing-remitting MS is. So for me, what that looks like is my body experiences attacks that are new symptoms, and I may partially recover from those symptoms or completely recover. It's really unpredictable. So when I say partially, even today as I'm sitting here, my feet are vibrating. It's like vibrated sensation. And that's due to me experiencing dead leg, drop foot, you know, years ago. And then going back to where I mentioned, I realized I was misdiagnosed. So when I became a patient at the Cleveland Clinic in 2022, they were able to bring up all my MRIs I had over the years. They mentioned the one in 2014. And they asked me why I had that done, and they zoomed in on my brain. And the lesions presented at that time. So that's why I realized, oh my gosh, I was misdiagnosed with neuropathy.
Wow. So you've got a lot
this
going
is a journey.
on.
Yes.
It's a huge journey. And there's so much more information I would love to get into. Time just does not allow. But you have some resources that you can share. You've got a walk coming up in April. So share a little bit about that. How do people connect?
Absolutely. If you are on social media, Twitter, Instagram, you can find me at the Katz. That's Katz, Z as in Zulu, way. And just click in my bio. From there, you'll be directed to join my team to register. The walk is being held April 6th at Sunset Park. It kicks off at 8:50 a.m. in the morning. Again, you can find that directly on my Instagram handle. For more resources such as MS, if you're curious, visit the nationalmssociety.org. It's a great resource.
Awesome.
Thank you so much for sharing your story and your journey. It takes a lot for people to do that, and we just want to acknowledge that. Everyone does not want to share their business, right? As we say in our community, don't share my business, don't tell my business, but sharing is actually caring, because somebody may have these symptoms and don't know what to even go to their doctor and ask to be tested for.
Absolutely. And again, there's a lot of nuances, and MS is hard to identify because it looks like a lot of other things.
Right.
Lyme disease, diabetes, Parkinson's. So it's really hard. It is not well exposed yet.
Right. Well, we appreciate your advocacy, and thanks for coming on with us.
Thank you for having me.
And this has been A Healthier Tomorrow. I am Will Rucker.
I'm Elisa Howard.
And as we always remind you, you are not just a drop in the ocean. You are the entire ocean in a drop. And what you do matters. So live compassionately. We'll see you next time.